Hello, my name is Kalia. Um, I'm here to just present on my pharmacology case study, competency. So we'll just jump right into it. My first case study, I have baby boy Jones. He was born a healthy male, 3.2 kilograms, spontaneous vaginal birth with no complications. His parents are Jehovah's Witnesses. At this time, they are refusing transfusions and they are also unsure about the vitamin K shot that most newborns will get. The vitamin K shot will prevent what's called VKDB, also known as vitamin K deficient bleeding, um, which all newborns are at risk of brain and GI bleeding due to those low clotting factors. So it's recommended that every baby get a vitamin K shot. Usually the dosage is 0.5 to 1 milligram IM intramuscularly in the vastus lateralis within 1 hour of birth. Parents should be educated on the risk of bleeding in their newborn. And then if they still are refusing the vitamin K shot, we'll go ahead and monitor baby boy Jones very closely for those bleeding risks. Um, isn't that a cute little picture? Okay, my second case study is Daniel Miller. He's a 32-year-old married Caucasian male. He is a software engineer with a supportive home life. He has a history of generalized anxiety disorder. He was recently taking sertraline, also known as Zoloft, but he stopped taking it due to the sexual side effects. So he is now looking to possibly taking benzodiazepine, um, specifically alprazolam, known as Xanax, for his panic attack disorder that he is now recently getting at work. And this is affecting his job performance. With the Xanax, we would be giving him a very, very small dose, starting dose of 0.25 milligrams PRN for 2 weeks, which is that very short term use. And that's because we don't want any dependency, which benzodiazepines are pretty prone to making people go through withdrawals and unfortunately building a dependence on them. As far as monitoring Mr. Miller, we would monitor for that dependence, the withdrawals. We would definitely educate on avoiding alcohol, as this can interact with the benzodiazepines and cause a risk of respiratory depression. We would also educate him on holistic anxiety management. This can be done through exercise, sleep, and therapy. And the plan for Mr. Miller is to follow up in 2 to 4 weeks and discuss a transition to a more long term medication plan, such as going back to sertraline, that SSRI, which will reduce the risk of withdrawals and dependency. And just making sure he's doing well. He's not showing any signs of suicide or anything. For my third and final case study, I have Lashana Lee. She is a 72-year-old female. She's a widow. She's living home alone with limited doctor visits. She has a history of AFib, hypertension, type 2 diabetes, and an ischemic stroke that was documented a year ago. She presents to the ER with AFib and tachycardia. Her heart rate was over 140. And so we're really concerned now getting a second stroke, right? So we're definitely gonna, when we're assessing everything, we're definitely gonna be assessing, the priority assessment is the stroke assessment. So she's looking at today. It's recommended that Mrs. Lee starts taking warfarin, also known as Coumadin. That's an anticoagulant The dosage on that would be 5 milligrams daily. Um, just before the first INR check. INR we'll talk about in the later slides, but um, it's a test to see her prothrombin time. So it's seeing how quickly her blood will clot. And we're going to check that regularly with powerful anticoagulants. Um, but she's currently, for her current medications, she's taking metoprolol, lisinopril, and aspirin. Aspirin is discontinued after starting warfarin. So just keeping that in mind. Um, for our nursing duties and assessments, we're going to be monitoring for that stroke risk. Um, we'll be looking for signs of bleeding and keeping that INR within range. For patient education, we'll go ahead and tell her to avoid alcohol, NSAIDs, herbal supplements, vitamin K rich foods. We'll encourage vitamin K rich foods, and then we'll also set up a pill organizer for her warfarin. And we'll also, yeah, so with the INR, we'll have a follow up after the ER visit. So she starts warfarin in the ER. 3 days later, we're going to need to do an INR check on her. And because she's, maybe older and maybe getting to be more immobile and it's hard to leave the house, I would refer her to a home health nurse for those checkups. And that'll just be a lot easier for Mrs. Lee. All right, so we'll get into the pathophysiology, the pharmacokinetics, and the pharmacodynamics of each of these case studies now, starting with baby boy Jones. Um, so vitamin K is key to starting the clotting factor cascade, which maybe you remember from A&P a while ago. You probably were all good students and remember all of this. But it helps with making factors 2, 7, 9, and 10, and as well as proteins C and S, which are made in the liver. Without vitamin K, these proteins are produced in an inactive form and can't do their job properly. So in this picture that we have here, we see that vitamin K is used as like the starting cofactor for all of these factors. If you remember the clotting cascade, it's a lot of clotting factors that all kind of cascade. So then the liver will synthesize um, vitamin K into prothrombin, and then prothrombin will, when you get a cut or a cellular injury, will be turned into thrombin. Thrombin gets converted into fibrinogen, and then that is now turned into fibrin, which helps with blood clotting. That's a very vague overview, but that's as far as I'm going to get into depth. Okay, perfect. So newborns are at risk for bleeding. Um, they have insufficient vitamin K due to limited placental transfer of fat soluble vitamins, which vitamin K is a fat soluble vitamin, and it has a hard time getting through the placenta. So babies don't have a lot of it when they're born. They also have an immature gut flora. They don't have enough bacteria in their intestines to produce vitamin K, which is how we adults will make our own vitamin K that way. So it's typical, and most hospitals usually have a policy in place that we always prophylactically give vitamin K to newborns. It's usually given intramuscularly in the vastus lateralis within 1 hour of birth to prevent bleeding. The vitamin K shot has a slower absorption rate, and this is due to the less developed muscles in newborns. So it has an onset of 1 to 3 hours and usually peak effect of 12 to 24 hours. And this is really good because it doesn't overwhelm the baby's system. So we kind of want that delayed, slower reaction time so that it has time to sort of not overwhelm the baby's system. So then with storing and action, vitamin K is stored in the liver and activates clotting factors for normal clotting. So it's very important that we start this in most newborns and that we're really educating the parents on why we're doing this. And it's not because we're evil nurses, it's genuinely for the baby's health and well-being. All right. So for Mr. Miller, now again, we're just going to go through the pathophysiology of panic disorders and then the pharmacokinetic and dynamics of benzodiazepines. Okay, so panic disorders, research is inconclusive on exactly what causes panic disorders. It's usually, there's a consensus though that it's from an imbalance of GABA, the neurotransmitter GABA, serotonin, and norepinephrine. Um, but today we'll be talking mostly about the neurotransmitter GABA. GABA is responsible for modulating brain activity. It helps promote relaxation by inhibiting excitatory signals. Um, so if you don't have enough GABA, this leads to excitable brain activities and feelings of panic. So that's why people with panic disorders have just kind of more of a sympathetic response system. If that makes any sense. And so we're going to go ahead. So benzodiazepine or alprazolam, known as Xanax, will enhance GABA at the GABA receptors in the central nervous system. And this has a quick onset of 30 to 60 minutes and a high lipid solubility. So it easily crosses that blood-brain barrier to quickly affect the brain. And then it really helps with those quick short of breath feeling that panic attacks will have. So that's why the benzodiazepines are so effective in treating those acute panic disorders. All right. The third case study, Lashana Lee. So she's got a couple things going on. So her pathophysiology, she's definitely the priority assessment and priority implication that we're going to be looking at as nurses is her risk for ischemic stroke. And this is because it's complicated because she has a history of hypertension and AFib. So, AFib causes blood stasis in the atria, which can lead to blood clot formation. The clot may travel to the cerebral arteries, causing a blockage and an ischemic stroke. Hypertension contributes to the endothelial damage and atherosclerosis, which is that narrowing of the arteries. And this especially happens in the brain. So this makes her extra at risk for ischemic strokes. The consequences of strokes are its permanent psychomotor and cognitive deficits and even death. So it's very important that it's treated and it's treated quickly. So that's why we're going to start Mrs. Lee on warfarin, also known as Coumadin. It's an anticoagulant which will reduce the clotting risks. It's given oral or IV administration. It has minimal liver metabolism and is 99% protein bound. It has a little bit of a delayed onset of 3 to 5 days due to pre-existing clotting factors in the body that have yet to be eliminated. So once that comes into place around that 3-day to 5-day mark, then we're looking at, that's why we're doing our INR testing in that 3-day range, right? So we're seeing how effective it is. And then we're adjusting the dose accordingly after that. So warfarin actually inhibits vitamin K epoxide reductase, which is a enzyme that reduces clotting factors over time. And I have this lovely image again. So, warfarin is a vitamin K antagonist. Um, it will basically just shut down all of the clotting factors because of that first step. If you can see, vitamin K Epps oxide reductase. So it shuts down that enzyme, which will stop the rest of the clotting factor cascade, which is important. All right. So with nursing considerations for baby boy Jones, it's important that we are prophylactically giving a vitamin K shot intramuscularly within 1 hour after birth to prevent that vitamin K deficiency bleeding. Um, it has proven to decrease mortality. Vitamin K shot has proven to decrease mortality, especially in preventing infant intracranial hemorrhaging, um, which can be life threatening for newborns. 95% of US newborns receive the vitamin K shot. So it's usually hospital policy to just go ahead and give it with, of course, the consent of the parents. Um, Patient education. So explaining the seriousness of vitamin K deficient bleeding in newborns, um, and the risk of bleeding due to those lack of clotting factors is important for that family to hear. Um, so when I was doing my research for this project, I found a research study that said that in a pooled study of 131 cases of babies, 63% of late vitamin K deficient bleeding presented with intracranial hemorrhaging, and 14% of those babies died and passed away. So it's very unfortunate, but very serious. And so it's important that we are educating the parents properly. And if they have any questions or they need extra resources to get an understanding, and really promoting that patient advocacy is very important in this moment, even if they have cultural differences that maybe they don't, because they're Jehovah's Witnesses, they don't want to do this to their child. And so being sensitive to that is very important as nurses. So you handle the situation respectfully while providing evidence-based information about the safety and efficacy of that vitamin K shot. Um, as nurses, we're going to have to respect the parent's decision if they choose to decline the vitamin K shot. But we're going to have to ensure, us as nurses, that we're educating them on the signs of bleeding that will require immediate attention. So, signs of bleeding, I have written down. Um, you're going to look for prolonged bleeding from the umbilical cord, unexplained large bruising, black tarry stools, and vomit. You'll also look for signs of hypoxia. That means like it's sort of anemic because of that blood loss that's happening. They'll look pale, cool skinned, cyanosis, restlessness, and then maybe loss of consciousness. Vital signs to monitor baby while they're in the hospital would be hypotension, tachycardia, and dyspnea. You'll also be watching for any sort of respiratory distress from the baby. So this would be difficulty breathing, and then that bluish tinted skin around like the lips and the toes and hands. So watching out for those is very important. You'll also take a maternal medication reconciliation prior to, probably when labor and delivery is happening, you'll probably see that she's had a medication reconciliation. So making sure that you're assessing those medications, right? So you're going to assess for anticoagulants that mom has taken. This could be warfarin or aspirin, any of those things. Herbs like ginkgo biloba, green tea, garlic, ginseng, and ginger that may thin the blood. This also will increase bleeding risks in the baby, right? Because it passes through the placenta into the baby just before they're born. And so when they're born, they are very, very deficient in vitamin K, and then also at risk of very thin blood as well. So it's very important that you're educating everything and getting a good thorough assessment on the mom and the baby, right? This, you got to take care of two people in this instance. um, Perfect. So for baby boy Jones, complement and alternative medications for him. Um, so there's really not an alternative to the vitamin K shot. It is proven to be the most effective and the only way to ensure that VKDB is handled correctly. Breast milk is not a substitute for vitamin K shot. It does not provide enough vitamin K for the infant. So therefore, they're still at risk for bleeding. An alternative would be an oral vitamin K. This is less effective than the intramuscular shot because you're having to give multiple doses over time. And it's a baby. It's not an adult, right? Where they can just pop pills. It's difficult to get a newborn infant to take an oral medication, and they risk spitting it out. They have to take multiple doses of it. It's just not as effective as the shot. But that is an alternative. So for Mr. Miller, nursing considerations here, we're going to be highly educating Mr. Miller on the use of benzodiazepines. So there's a timing of medication, right? So you got to educate Mr. Miller to take the medication only when he's experiencing a panic attack. You also emphasize a non-pharmaceutical treatments like therapy, exercise, proper sleeping. You should be getting 7 to 8 hours a night, guys. And that will help definitely complement the medication, especially in sort of any sort of mental health crises. It is very effective to use pharmacological drugs as well as those non-pharmacological drugs. It's important to do both. You should be educating Mr. Miller that he needs to taper off his benzodiazepines under medical supervision to prevent withdrawal symptoms like seizures. Signs of overdose and side effects to watch out for would be drowsiness, seizures, respiratory distress, mood swings, and suicidal thoughts. And these will require immediate medical attention. Assessment considerations for nurses, you'll take a mental health assessment. You're going to assess Mr. Miller's mental health status, including the impact of his panic attacks on his work performance. You're going to look into and see if he's ever had any substance abuse. You'd screen for a history of substance abuse, particularly with any CNS depressants, such as alcohol, to avoid any additive sedative effects to those benzodiazepines. And then lastly, you're going to make sure that you're going to monitor for that CNS depression. This would look like drowsiness and then respiratory distress, right? Because you're not getting enough oxygen if you're too sleepy. Important drug interactions. So you definitely need to warn Mr. Miller about things like interacting with the benzodiazepines. This can include passion flower, valerian root, chamomile, CB or THC oil, and kava. This may cause CNS depression. Also keep in mind too, there's also reduced effectiveness that can be caused from substances like St. John's worts, highly caffeinated drinks, and ginsengs. This will reduce the effect of benzodiazepines. Couple things. Benzodiazepines comes with a lot of risks. So you need to make sure that you're educating him on that. So, and it's important for you as the nurse to understand as well that it should only be used for short time use. Long-term use of benzodiazepines, Mr. Miller would run the risk of addiction, CNS depression, and potential for suicide during withdrawals. And then you'll also be closely monitoring, ensuring that those benzodiazepines are limited to a short period of time, and then closely monitoring for side effects or disuse or misuse. Um, yes. So, and then as we sort of talked about here with the complement and alternative medications for Mr. Miller, um, this is really important for your mental health, especially with someone like Mr. Miller, where he is experiencing those panic attacks. It's super effective that um, he's seeking therapy. You can talk through emotions. Talking with a therapist really helps with processing emotions or trauma or overwhelming thoughts rather than letting them all build up, right? Therapy can also help with building coping skills. You'll learn tools to manage stress, anxiety, depression, panic attacks. Those tools are awesome. Exercising is also very important. It's interesting, it releases endorphins. These are your brain's feel good chemicals that reduce pain and boost your mood. It lowers stress hormones. Physical activity will lower your cortisol and adrenaline levels, which are often high with anxiety or chronic stress. And sleeping. You should be sleeping 7 to 8 hours nightly. Um, it, and because you want to do this, because it restores your brain function. Sleep helps clear the toxins from your brain, helps with your memory and learning. It helps also regulate your mood. Lack of sleep will make you more irritable and more anxious. So you want to make sure you're getting that good sleep, guys. And then it can also balance your hormones, specifically the neurotransmitters like serotonin and dopamine, which are key for emotional stability. So, um, yeah. And then we'll move on to Mrs. Lee. So, for Mrs. Lee, um, stroke assessment is your priority. When she's walking into the emergency department and you're seeing all her past history of everything, your priority is your stroke. You'll take a neuro assessment. So this will be you'll be looking at an asymmetric face drooping, unilateral limb weakness, slurred speech, and sudden cognitive changes. um, when in doubt, you get an MRI, and you'll speak with a physician about ordering an MRI to diagnose or rule out that ischemic stroke. Okay. And then that medication reconciliation. So she's taken a couple medications here, and we have to be really careful because this can affect her blood pressure and put her at risk for falling. So a couple things she's taking that puts her at risk for falling in orthostatic hypotension is that metoprolol and lisinopril. It's important that we know these things, right? And we know the dose of these things and ask her how she's doing on them. Does she feel dizzy currently? Does she feel dizzy when she stands up? It's important to take those in while you're doing your assessments. She's also discontinued, but she was taking aspirin, but now that's being switched to warfarin. So we're going to educate her to stop taking aspirin. Stop taking that. It will just double up and will be really bad. So patient education on fall risk and safety. So you're going to educate Mrs. Lee and her caregivers about the increased risk of bleeding associated with warfarin, particularly if she falls while taking metoprolol and lisinopril, right? Because that orthostatic hypotension. Home safety is super important for older adults. You're going to encourage these anti-fall measures like suggesting grab bars, removing loose rugs, improving lighting, using assistive devices, and wearing medical alert bracelets indicating that she's taking warfarin. You're also going to use a pill organizer. It was stated in her admissions assessment that she has recently has been experiencing a cognitive decline. So it might be really helpful in this case to have Mrs. Lee use a pill organizer, especially since warfarin works best with consistent use. Um, And then we're also going to educate that um, she's avoid she's going to have to avoid a couple things while taking um, warfarin. She's going to have to avoid NSAIDs, ginseng, garlic, ginkgo biloba, and green tea, and that's just because it puts her more at risk of bleeding. And then you'll look for those signs and symptoms of bleeding because she's taking that warfarin now, and that would look like unexplained bruising, tarry stools, coffee ground vomit, and then that prolonged bleeding from minor cuts. And it would also be really, really helpful for Mrs. Lee to get that referral to a home health nurse, considering that she's going to have to get regular checkups for her INR checks. So, and that way, then the nurse can do like a home safety visit, where she can set up those grab bars in the house for Mrs. Lee and set up the pill organizer. So I think a home health nurse would be really helpful for Mrs. Lee in this case. Um, this is yeah. So now we're talking about the INR monitoring, which I mentioned before. So INR stands for International Normalized Range, and this again tests for that prothrombin time or how quickly your blood can clot. Um, it ensures so monitoring INR levels helps ensure that patients are staying within the therapeutic range, indicating that warfarin is effective and preventing that formation. So a good range is 2 to 3. And then you'll do the frequent monitoring. So an initial monitoring is done 3 days after starting warfarin, because again, it takes a while for the medication to catch up and be effective because we're still getting rid of the pre-existing clotting factors. So at that 3-day mark, we'll go ahead and start those INR checks, followed by a weekly INR checks and to adjust the dose as needed. Warfarin is super, it's been around since the 80s, so it's super effective at what it does, and there's all these checks and balances involved with warfarin because it's been around for so long. So it's the gold standard for preventing ischemic strokes, especially with patients who have a history of AFib. It's been shown to prevent 65% of ischemic strokes in patients with AFib. So it is become the gold standard of medications in preventing ischemic strokes. So for Mrs. Lee, things that you can suggest as her nurse as a complement to warfarin is a diet that's rich in vitamin K. And this is to sort of help with it helps with like minimizing fluctuations in the INR levels. It keeps if you keep a consistent intake, it helps maintain a stable warfarin effectiveness. Exercise is also very important as well. This can encouraging exercise can help with cardiac output and blood flow. So it reduces the blood vessel resistance, and that's really important in decreasing atherosclerosis and hypertension. And it's recommended that she at least do 30 minutes per day, but because she's more of a fall risk, just encouraging small little walks outside, maybe gardening, swimming, those things will all be helpful. All right. Okay, so key takeaways. So, couple things here. So, with baby boy Jones, as his nurse, you're going to make sure that the family is educated on vitamin K's role in preventing vitamin K deficient bleeding. Vitamin K deficient bleeding may cause fatal intracranial or GI bleeding. And because they are sort of declining because of their religious beliefs, you're going to be really respectful as a nurse and just sort of keep educating. Find any gaps where the family is not understanding, and hoping to fill those gaps with education will only help with your patient advocacy at this point. But again, if the family refuses, you're going to continue monitoring for bleeding assessments. Um, and then for Mr. Miller, for the benzodiazepine use, um, he was given alprazolam for panic attacks limited to 2 weeks. You're going to monitor for side effects. So that CNS depression, the dependency, and you're going to watch for signs of any abuse of benzodiazepines. You're going to educate on proper PRN use. So again, Mr. Miller should only be taking benzodiazepines when he feels the panic attack. Okay, not just willy nilly whenever he feels like it. Um, and then you're going to have to suggest as well that there's other effective measures that coincide with benzodiazepine use, such as exercise, therapy, sleeping. And then you're going to definitely check up on him. You're going to do a follow up. You're going to do a mental health status assessment on him. And then you're going to hopefully suggest and uh, hopefully taper him off of benzodiazepine and transition him to an SSRI, which can handle that more long-term use and management of panic attacks. Um, and yeah, okay. So then for Mrs. Lee, for that warfarin administration, you're going to be making sure that those INR levels, the goal is 2 to 3 to prevent stroke in AFib. You're going to educate Mrs. Lee on those warfarin side effects, which is those risks of bleeding. So you're going to look for bruising, tarry schools, etc. You're going to have to educate on avoiding NSAIDs and herbal supplements that can interact and increase that bleeding. Address that cognitive decline, right? So we're going to refer Mrs. Lee to that home health nurse and suggest a pill organized as well as a safe home setup. And then also taking into account those medications that she's taking. She's taking metoprolol and lisinopril. That causes orthostatic hypotension. She's at risk for falling. So just making sure that you're educated on that and using your critical thinking skills as a nurse. Implementing safety tools. So you could suggest a life alert for those falls, canes, grab bars. And then remember that like tailoring your patient education and monitoring to minimize the risk and optimize warfarin's effectiveness is key and the goal of nursing here. And you're going to use all of these things and all of your critical thinking skills to think of all of these individuals, right? Baby boy Jones, Mr. Miller, Mrs. Lee. You're going to think of all of your critical thinking skills and taking everything into account and making sure that you're doing the right administration, patient rights, as well as properly educating the patients and their caregivers will only help with your clinical judgment and your critical thinking skills as a nurse. And then lastly is just those reference pages. Thank you for watching. Yeah.